Well, Dr. Good, thank you so much for joining me for this conversation today. I know you feel very strongly about supplements. You and I have talked about it a little bit. And what's great about you is you take a holistic approach to treating your patients. And I understand you often suggest supplements for some of your patients. Is that right?
Yeah, I mean, as a spine surgeon, that's not my primary thing, but we get into health, fitness, longevity. A lot of people I'm seeing are there trying to avoid back surgery down the road. So this comes up as part of that overall process.
Yeah, so and I know not all doctors do that. So I'm curious how you started down this road on having supplements be so important to you. And was it your own experience with supplements, or was this part of any kind of medical training that you got?
Definitely not part of medical training at all. Certainly not. Like if you're a spine surgeon, just sitting around talking to people about supplements is, a waste of your time. I think it's a combination. Part of it is my own family history, my own, back issues in our family. Part of it is some phenomenally healthy, motivating people that I am lucky to spend time with and are, kind of my gurus and looking at what they've done and really trying to kind of get in that mindset of saying, like, what are the things we can do to prevent, if we can, prevent disease, feel better, take control where we can. A lot of what happens to us is a result of genetics and luck, and we don't have control over that. But, if you look at it, a lot of the reasons people get cancer are modifiable, preventable, and there's a lot of control that we do have, even though we can't do everything. I certainly like to shift the odds in my favor as much as possible. And so,
Right.
the challenge with supplements to me, it's sexy. People want to do it.
Hmm.
There's money on the industry side being made, so there's lots of advertising there. And
Yeah.
so, you know, the reality is that I think there are a lot of things that people can do to improve their health or modify their future that are maybe more powerful and more proven than supplements. A lot of those things are just hard work and dedication, whereas the supplements are kind of an easy thing. Oh, I'll just take this pill and it's going to make me feel great, and I'll look like that 80-year-old person on TV who's running a marathon.
And it's not that easy.
No,
No,
no, it's
and it's really it's a confusing topic for a lot of people. So we'll get into like kind of your non-negotiables, the things that people should be taking. But first, I want to open up your medicine cabinet and get. I always love to hear what the doctors are
not.
doing because it kind of sets a standard. But I know we don't want to exactly follow what you're doing because it's personalized, right?
Yeah, I think people are all, and myself included, I'm always hesitant to give you my list. One, because you might think I'm crazy. Two, people always ask me, they were looking at their back condition and they say, what would you do if you were me? And I'd say, well, like I might not be a good patient, right? Or the kind of risk tolerance I may have at my age and my quality of life might be very different than yours. And
Right.
so
Okay,
I
so
think
let's try it out. So tell me what you take on a daily basis.
So I think what I would love to do is start I think there's a lot to be said about looking at your genetics, your
Mm,
family history, and trying to do precision supplementation, right? Like,
mhm.
I don't think that there's anything that everybody should do. But I think for sure, if we're trying to be data driven, and some of the things that I do maybe aren't for myself, but if we're trying to be data driven, right, there is osteopenia, osteoporosis in my family, right? I can measure a biomarker showing my own bone health, my calcium level, and that tells me I want to be super proactive in that area, right? And so I think areas where we can be precise, whether that relates to family history or personal problems, whether you've had an injury or a diagnosis, makes sense. So for me, like if you have weak bones or low vitamin D or bad absorption in your intestines, being on calcium and being on vitamin D and focusing on that on the dietary perspective is like
Mm.
super super important. There's lots of like data, right, to support that's a good idea, right? If you have a history of elevated cholesterol or it runs in your family, you should be working on your diet. But some medicines that you can take, supplements that help to decrease how much cholesterol you absorb from your intestines,
Hmm.
might be a really good idea for you, right? And so that's where I really think that trying to, rather than just say, here's a medicine for inflammation, here's a medicine for energy, something for weight loss, I think we really need to look at each other. I think in general, calcium, vitamin D, getting that from your diet, getting from sunlight and supplements is really applicable to many, many people. I think if you look at heart disease, right, everywhere out there, things like omega-3, these kind of fatty acids in supplementation.
Yeah.
There's probably a role for a lot of people to be taking that. I take a high dose of vitamin D because I see the range of what a normal vitamin D is, and it's a huge range. And given my history and my desire for strong bones, I want to be on this side of normal, not this side. You know what
Right.
I'm saying?
Okay, so let's take this one issue by one issue. So I hear what you're saying is that it's really catered to customized to the patient, which I wholeheartedly agree with that. You can't just throw a bunch of supplements and say, okay, that like you said, this is going to make you better or make you stronger or make your life longer. But so let's break these down one by one. Let's talk about inflammation because a lot of people are focused on that. And I know we've done a past episode on inflammation and how it impacts your back. There is so much in our environment and in what we're eating through pain that can, trigger the inflammation or the inflammation causes the pain in some ways too. It's flagged as the enemy. That's the bottom line. And it can become chronic and can become harmful. And if it's not addressed, we're talking about that chronic back pain. Talk about some of the supplements that people can take to help address inflammation, because I would imagine a large part of our population is dealing with some sort of inflammation.
Yeah, I think the topic of inflammation is critical, and one challenge is inflammation has kind of gotten this like grab bag. It means everything bad, right? And we need to remember like inflammation is a normal part of human life. We wouldn't be alive if we didn't have inflammation. Inflammation helps us heal injuries, fight cancer, respond to vaccines. You get a bug bite, you get swelling, that's inflammation. So inflammation is is needed. The key is like understanding the balance of that inflammation, and especially as our lives go on, because what happens is we tend to get more inflammatory response as we get older, especially over the age of 50, and then especially over the age of 60, right? This term inflammaging, right? And
Mm.
so it's kind of a matter of like you want to get just the right amount of inflammation, because if your body can't fight off infection and cancer, you're no good. But we know that increasing levels of inflammation over response to injury, there's all these disease processes that go along with that. Everything from heart disease, cancer,
Right.
Alzheimer's disease, right? And so I think there's a difference between kind of general body inflammation and supplementation, and
Got it.
I have a specific injury I'm trying to heal, and
Okay.
the inflammatory process. But I do take medicines to fight inflammation.
And so, what
Um,
supplements do you suggest for patients who are dealing maybe with chronic inflammation?
well, I definitely I think that there's a lot to be said about green tea,
Mm.
and so there's a lot there. There are some like capsaicin, which is right from peppers, is another really great way to go. I personally use turmeric kind of on a regular basis, and that's another kind of very common supplement people use to fight inflammation.
Yeah, I've heard that can upset some people's stomachs. So I guess you just have to figure out what's right for you.
It certainly can. That's definitely a take it with lunch with a full stomach.
Yeah.
Otherwise, you'll be noticing it down the road. And again, medicines to fight inflammation, many of them supplements or prescriptions, can have effect on stomach acid. And so, again, if your problem is stomach ulcers and indigestion, boy, we need to be customizing
Yeah, again,
that.
very personal. Let's talk about joint pain because I know you're dealing with that a lot in your practice at VSI. Um, what supplements would you suggest to help alleviate joint pain? I've heard you talk about glucosamine and chondroitin. Is that something that you really recommend to your patients?
Yeah, so if you look at the data on spine, there really isn't any. And so I have definitely have patients who hear about it. They see the potential benefit of decreasing inflammation of the joints, perhaps protection of the cartilage, especially there's some encouragement in more of the orthopedic, joints, hips and knees and things. I absolutely have people who use it and swear by it and get a great response. When I'm looking at it for somebody who, for example, has disc disease and back pain, I have a hard time saying that there's like a lot of data to support doing that. But I think it's a really popular one that's out there. It's also a challenging one because there's a tremendous number of formulations, and we know with supplements, that because these are not super regulated by the FDA, the purity and the absorbability and the quality of what you're getting from different supplements is really variable. So need to be mindful of that.
We'll get into that a little bit later too. Any other supplement that you would suggest for joint pain?
For me, I think that's those are the main ones that we would really use.
Okay.
I always have to do a plug. Like, I think that we spend a lot of time trying to fight inflammation with medicines or supplements. I also put a plug in for diet, because if you avoid putting pro-inflammatory stuff into your body, I actually think that's better at controlling symptoms than putting pro-inflammatory stuff into your body and then taking a medicine to counteract it. So
Hmm.
we know especially the Western diet is full of junk,
Yeah.
processed foods, super processed fried foods, and those chemicals are extremely pro-inflammatory. And I have lots of patients that getting them onto an anti-inflammatory diet or simply improving the quality of their diet will get them as much benefit as turmeric or an anti-inflammatory, even a medicine or a prescription. Or I mean, sometimes we even go to like bigger guns like glucocorticoids, which are oral steroids. But
Mm.
I have to tell you, I think that the dietary side of that cannot be neglected. And
Yeah.
I'd attack that first. I like the supplementation. I feel like people who get super into it are doing all these different things right. And I actually feel like if you think about kind of the pillars of health, right, like sleep, exercise, nutrition, mindfulness, whatever, as you start getting into that, like the supplementation layer of importance to me is down the line. But if you're getting to the point where you're doing all those things right and you're really focused on your supplements, I think that's a sign you're doing a lot of other things right. And even if you're not doing everything perfect, man, you're really elevating your entire playing field once you get to that level.
Yeah, that totally makes sense. Food as medicine first, and then bring in the supplements. Yeah, that makes total sense. You touched on maintaining good bone health. I know that's something that you're talking about is important for you. It's important for everybody, obviously, but considering your family history, um, what do you suggest for bone health? Is it pop? A lot of people, myself included, pop a Tums a day because I know there's calcium in there. Maybe that's not the way I should be going about this. But how do you know, number one, that you should be taking a supplement for good bone health, and number two, what do you suggest?
Yeah, I think we're at the point now where we can take a drop of blood and measure 10,000 proteins, right? Not that we all need to do this, but there are standard panels that we can look at to get a basic idea of your genetics and a basic idea of how your kidneys, liver, bone health, heart, inflammation are doing, right? And I think there's a tremendous benefit to using that. We call anything that you measure, like they call it a biomarker, right? Anything that we can use to get an idea of where the body is. And then we can follow that biomarker to see how the body does over time. I mean, even as simple as weight is a biomarker, right? Like, hey, I'm obese. I can do different interventions. And if I see that biomarker change, I can get an idea if it's helping or not,
Right.
right? And so I think that's really the way to go, right? And so for me, like we talked about bone health, but really, you can measure the density of the bone with a very simple test called the DEXA scan. You can measure your calcium and your vitamin D. When it comes to calcium, I choose to take a calcium gluconate substance because it is easier to absorb, whereas Tums is
Mm.
calcium carbonate. Okay, little bit less absorption from the stomach. And the reality is, our body's not great at absorbing nutrients directly from supplements. It's better from whole foods.
Hmm.
And so, if you're going to do, however, you're going to get your calcium, you want to do it in multiple doses throughout the day. You want to optimize what you get through your diet. But I know I'm not getting enough through my diet alone, so I'm taking 650 milligrams of calcium twice a day. I take 10,000 units of vitamin D. twice a day. That's, I think 5,000 units is a very common recommended number for anybody with any kind of concerns about their bones or osteopenia.
Hmm.
But I think the most important thing is we have a biomarker. We can measure the lab value. Let's see where we are. We see what the dose is that we want to try. We retest in 3 months and we find out if we're in what we'd consider the ideal range. Now, we don't have biomarkers for everything we'd like to change in our bodies. We're getting better. But I think that is really where there's a tremendous amount of benefit. There's a huge amount, obviously, going toward weight loss, right? That's a huge thing that's going on right now, not only in terms of supplements, but other medications. And there are a number of different factors you can look at in terms of not only maybe your weight, but your insulin level, your long-term glucose, other effects on your tissues, so that as you try different changes to get your body to go down, you're able to follow all these biomarkers to determine if it's working or not, right? And and similarly, like another one that comes up a lot with bone health is estrogen and testosterone. And
Yeah.
this is a hot button one because there's a lot of concern about um, um, menopause and the symptoms that go with that. There's also concerns about estrogen and its effects on cancer.
Hmm.
Also, on the men's side, there's a lot of men who would really love the idea of being on testosterone for some of the youthful, muscular, otherwise benefits that you can get. And those all can have effect on bone health as well. But
Mm.
you really don't want to just start testosterone, right? There's
Yeah.
there's potential downsides, especially on the prostate side. So that's an idea where you really do need to get a lab value, find out where you're at, so we're not throwing these substitutes in hibbly bibbly. I personally, my doctor, I was like, hey, let's do some testosterone. And he's like,
Mm.
that is insane. Your testosterone is already like very, very good. I'm like, but it could be better. And he says, no, right? The
So
risk
the
of your
test
kidneys
is,
doesn't make sense.
but the test is the truth teller. That's where you get the information that you need. Are there are there brands of supplements that you like better than others?
Oh yeah, there totally are. And what's interesting is, and again, I try not to like, plug a brand or whatever
Sure.
unless there's a good reason. But even within different supplements, if you really look into the purity, I think you'll end up finding it's not like one brand is always better. There are different brands that really stand out. So, like I take for example, I take a something called resveratrol, right? That's from the skin of red grapes, and so the hope is it has these antioxidant properties, and the thought is that's good in terms of avoiding aging. And when I go in and look at my resveratrol and I decide who to order it from, there's all different companies and whatever. And I really do try and get into it and try and get an idea of what is the purity, what's the reproducibility
Mm.
of any company. And so I have to tell you, when you look at my medicine cabinet, there are 10 different companies that I'm getting my supplements from.
Okay.
Part of it is um,
You're looking at the
I
purity.
yeah, well, I'm trying to look at the purity, and then part of it is habit. Part of it is, my gurus who put me onto some of these have said these have been great for them, and so
Hmm.
there's a lot they can go into that. But I do think you wanna if you're getting into it at the level where you're really taking multiple supplements, you're going to be spending money on this.
Yeah.
You're going to be doing this on a recurrent basis every month. I think spending a little bit of time on the biomarkers, a little research, and the purity, makes a lot of
Yeah.
sense.
Well, you mentioned the resveratrol. There's a lot of data on collagen these days, and I know it's the most abundant protein found in the body, primary building block of skin, muscles, bones, tendons, ligaments. How do you feel about collagen supplements? Is that something that everybody should be taking?
I definitely don't think it's something that everybody should be taking. I am not actually, just for what it's worth. So definitely not everybody, or I would, if I thought everybody should be on it, I'd be on it. I think it's one of these where intuitively it makes a lot of sense. Building block, most common protein, all of this. The question is how does getting that collagen in my body through my mouth end up with the right kind of response in my tissues that need collagen? And so I've kind of been a little slow to like be able to follow the success of that treatment through in terms of having some kind of data to support it. It's super popular. It's probably one of the most common things that people are on. I think it's safe. I think that's another really important thing with supplements is if you want to try it and it makes sense and I don't see any downside, I'm like, hey, it's fine. Supplements that have potential side effects, really negative factors to them, those are the ones where I really want to put the brakes on for people. So I let people kind of go for it with college.
So I was going to ask you, what do you recommend people stay away from and why? And I think you just answered that. Is there anything else that I mean, like specifically that you would say this is a trend, go away from that, run, that people shouldn't be taking?
Well, I think on the weight loss side, things that have tremendous amount of caffeine and stimulants to
Mm,
them, and they're widely available. They seem great. You know, the idea you're taking something, it ramps up your metabolism, and you're just burning all these calories. I think you want to take those with a lot of caution, right? Especially if you have anything going on where you're worried about, your blood pressure or your cardiovascular health or anything else like that. And the reality is, many people who want to take weight loss supplements because they're carrying more weight are the ones who are at risk for that. So
mhm,
that's my number one, be cautious
mhm.
is, we don't want to put a lot of stress on your heart. I also think I do caution people about the Tums or other brands. Too much calcium, if you have too much calcium or certain kidney problems can certainly lead to issues, kidney stones and things like that.
Noted.
So
Thank you. Thank you.
yeah.
I will watch my Tums intake.
Those are no fun from what I have heard and seen. So we definitely want
Yeah.
to be a little cautious with
I'd like to avoid that. You're talking about some of the things that we want to watch out for, maybe some of the dangers, and we know that supplements are not regulated by the FDA, so this can be very confusing. Like you said, you've got to do your research. From a safety perspective, how do you personally find places to get that? Like, is there a place that we want to go to in terms of a retailer where you feel confident about what you're getting? Is going down to the local GNC or to the grocery store? Like, what do you recommend people do? Is it talking to their doctor first and getting those biomarkers?
Yeah, I think that there are some very great, sophisticated doctors out there who really know about all this, but I'm not sure that you roll into your PCP and get a really great discussion about supplements and it's just they have so many things they're worried about. They're under so many pressures, and Western medicine, I think, is it doesn't teach doctors about this. So I think it's on your own. You need to do some research. I think that there's a lot, you can find a lot of information. A nutritionist who's really into this can be super helpful. I have used an app I found where, you can have your blood tested and they give you some information about your genetics and looking at your blood work, they suggest some different supplements. They actually will suggest from a dietitian point of view which supplementation might be, maybe the better version, right? Which companies make pure versions. I I think part of that, when I do that, I know that there's a business model there, right? And I understand the limitations of that. But I also think if you're trying to figure out how to get started, I'm not going to fall for something some app tells me to do.
Yeah.
But it is kind of nice to have something that says, hey, here's some suggestions. And the app I use gives me like a daily checklist, which has grown over the years. So it's like forever now. But every day I have an app that asks me, did I do a HIIT workout?
Mm,
Did I do some weightlifting? Did I follow my sleep schedule? Did I take my ashwagandha? Did I take my,
mm.
did I take my, I take some two medicines that are meant to prevent absorption of cholesterol. My cholesterol is normal, but I've chosen to do that, right? So it asks me, did you take your ALA, right? Did you take your, I don't want to I'm trying to avoid giving a brand.
That's it.
Uh,
What's the app?
so the app I've used is it's called InsideTracker.
Okay.
And as a doctor, I'm certainly not plugging everything that they say there.
Of course.
Their kind of gimmick is like by looking at all your blood work and your genetics, they can calculate what they say your internal age is,
Right.
versus your chronologic age. And if it's devastating to find out that your internal age is higher than your chronologic age. I know that because that's what mine was when I first started. the power of it is um, these suggestions, I think many of them are okay and good, but having this app that tracks it and over time you repeat your blood work and you can see things change, there is this nice accountability platform that is there. And we are trying to use some biomarkers to actually make progress, right? And I think an even better version of that would be an awesome exercise physiologist, nutritionist that I go to every 3 months. But we have to live in the real world. We're not able to do that.
Right.
And so being able to have some of this at our fingertips is great. And it's funny because I got to tell you, the days I check off every single thing on my list and it gives me a little,
Mm,
celebration, like, yay, you did it today. It's actually been helpful to me.
yeah.
Some of the suggestions it has made, I completely discount and don't agree with. Like it's
Sure.
always pushing me to eat whole grains, which is not something I want to force myself to do. It's always
So it's
pushing
really
me
a
to be
guide.
vegan. Yeah, and you get suggestions, and then you get to make selections. And so I think if you go on and do something like this, it's basically a lot of ways to skin a cat, but it's let's get some biomarkers. Let's understand what I need based on my family history and my own problems. Let's get a plan together that has some science behind it. Let's set some goals, and then let's do it for a while,
Mhm.
retest, and it doesn't matter if the biomarker is your weight or your cholesterol or your insulin or your calcium level. Let's retest, make sure we're getting the response we want, and continue to evolve.
And that's the victory that you see over the time. It's getting those tests to show the biomarkers have changed, have improved, but it's not necessarily, oh, I look 10 years younger, oh, I feel like, a 16-year-old, but it's really following up on your own healthcare to make sure that those supplements are working for you. Okay, so as we wrap up, let me ask you really quickly about mine, because
Well, just let me
I,
say, so like if we look at my own personal experience, when
yeah,
I said, you know, boom, you're 45, like that my dad passed away at that age, I was like, oh my God, I've got these kids. I have a really hard physical job. I need mental clarity.
yeah,
I started a lot of things at once, right? Exercise, nutrition, sleep, supplementation, meditation. What I can tell you is I found that my age went down, my biomarkers did well, and I started feeling so much better, mental clarity, stronger. And so I don't think it was any one of these things,
sure,
but I can tell you, we want the biomarkers to show improvement because we think lowering your cholesterol decreases your risk of a stroke. But if you're doing them, there's also the health. You feel more energy, you feel more fit, you feel mental clarity,
yeah.
and so it takes some time sticking with it. But that's the payoff there, right? And
Hmm.
so yes, I celebrate when some lab value is better or when my weight gets to my target goal is amazing, but really, it's the big picture. How do you feel every day when you
Yeah.
when you get out of bed?
All right. So D3K2, something I take every day. You approve?
Yep.
Okay. Magnesium.
Magnesium. I think most people will probably get some benefit out of magnesium. I like to take it a formulation that I think is absorption, so I get for sleep too. Just got to be a little cautious because some people will cause their GI system to become
Yeah.
a little overactive, and
Right.
and that's not a fun side effect.
Yes, that is not fun at all. And there are different magnesiums too that I know we need to pay attention to as well. You mentioned the sleep. There's for joint. There's cardiovascular. Let me ask you about B12. So this is something I also take every day. Good for good for me or
So
no?
Well, you need to check your levels because I took B12 thoughtlessly back before I took supplements, and my B levels have always been actually too high.
Oh,
So I would check the biomarker. I think in
okay.
general, the B vitamins, make sense. I think it's a good class to be on. But I'm a case study for that because it turned out the first thing I learned when I checked my biomarkers was I need to get off of that. And
Oh,
so, it's worth
okay.
investigating.
All right, great. Thank you. Actually, I have a blood test coming up on Monday, so I'm doing my due diligence. Thank you. I will check that one too. Fish oil. We hear a lot about fish oil, but I know that is something that you need to pay attention to. The ingredients, the you had talked about, just really doing some investigation on your supplements, and I know this is one maybe that you need to be careful of.
Yeah, I think this is one that I think many people can be on. You know, the side effect profile, the downside of it is very, very low. I think the cost is pretty reasonable. So it's absolutely on my list every single day. And if you think about kind of the cardiovascular benefits of it down the road, pretty
Yeah.
easy to feel good about. Yeah.
Okay. And then my final one, also for cardiovascular, ubiquinol.
Um, I don't know enough about it to make
Okay.
a strong statement one way or another.
Okay. I'll check my blood. I'll check with my doctor. I'll do that due diligence that you're talking about, and we'll get this figured out. Well, thank you so much. It's so insightful, and I appreciate the work that you do to watch the whole patient, not just not just surgery, not just treat the symptoms, but actually long looking at patients long term.
The
So
only other thing I would say, just wrapping up, is
yeah.
my current problem. You know, I've added supplements and I've retested, and I found I wanted to add an upler supplement, and now I've gotten out of control where I'm dissolving so many pills every day, and
Mm,
so you really need to keep an eye on things over time, right?
okay.
And you know, people can get to the point where this becomes, you don't want this to be the only thing you're doing to focus on your health.
Exactly. Yeah. Well, our bodies change, and yeah, you're right. Supplements are important, but to really look at the whole body. Dr. Good, spine surgeon at VSI. Thank you so much for your insight. Really appreciate it.
Thanks for having me.